I would like to tell you a story. I'm not a storyteller, but I'm trying to tell you is that what I have experienced in my life, and that has helped me in teaching these babies, and also some of the experience which I had. I want to share with you so that even you are managing your patients, you do not falter and you do the right way. Maybe some of these slides may be same as Ariba has presented because we work together, and maybe some repetitions, but what I'm going to tell you, what he told you was correct, but I'm going to tell you a bit more from my experience. This is a child, you can see is a 32-week child and got 400 grams, the PCR 39 weeks, the child has septicemia. And you understand septicemia is there, so likelihood that there will be some problem. See, I'll tell you something. When you see this baby grow, your mind should start working there and there. You can't say that, do this something like this and something like that. Your mind should work there and there. So the mind works like this, septicemia, the child 32 weeks, you may relax, and 49 grams, but not much. So don't relax too much. See this baby, we have it. And see this baby, there is a regress spontaneously, don't find a ridge. You find that the vessels are going in the vascular area. And what is the lesson? Lesson is, you should do a good follow-up. Screening does not mean one time examining the baby. The screening means examining the baby during the follow-up. And that's very important. I tell you something from my experience. I started the ROP program there. I remember, the nasal retina vasculitis at 36 weeks PCA. The temporal retina vasculitis at 40 weeks PCA. So if you want to tell a baby or a parents that your child is free from ROP, at least give a leverage of 4 weeks more, 44 weeks, you are safe. There what happened, one of the babies were examined. At 26 weeks, nasal retina was vascularized, and they were told that your baby is out of danger. Lo and behold, the child come to me after say 3 months, and I find the child has gone to stage 4 ROP. What I am trying to convey to you is that please see that the adequate follow-up is there at frequent interval, and see that at least 44 weeks has passed, and you have satisfied yourself that the vascularization has gone up to the desired zone. I don't say it will not go to the Orasarata, but definitely it has crossed zone 3 operated. So that's very important. And don't hurry up for the laser. I have seen patients where they have come as a ridge, and the laser has been done. Basically, it is spontaneously regress. So it's a question of balance, We always say ROP is a game of, what is the game? The game of chess. And who is the grandmaster? The grandmaster is the owl. We are the players, we do not know. Because the grandmaster is the boss. So that's very important. We go to story number 2, see what is there. The vascularization is there, but the vascularization has not gone, beyond the desired level. The 39 weeks, 1000 grams. Again, there is some suspicion that the child may develop some blinding ROP. Has come at 33 weeks, but sepsis and jaundice is there. So this is very important. And oxygen. Next, we at PCA 34 weeks. But you can't make out much. And then what happens? We did an angiography. We wanted to do the laser, but we wanted to be sure what are the vascular. And when we did the angiography, we very clearly delineates the vascular area and the vascular area. And then jolly well you can do a laser for this child. 3 weeks post-laser treatment at PCA 37 weeks. For example, what is the experience? What do I mean by experience? By experience, I mean that certain selection are there. If you are in suspicion, if you think that you are not able to discriminate between the avascular and the vascular area, then you can do an angio. It's not an easy game. But nevertheless, if you have the facility, you can definitely do it. As Parita showed you, there was a case where the reach was posterior and the laser was done much anterior to that. With the anterior, the two regions were there in that case. So this is something that one has to be very careful. This is the story number 3, and this is the story number, not strange story. See what you see here. What do you see here? I think Mangat also showed this picture. What do you see here? The laser has been done posterior to the avascular area. And if you call it PRP, this is not PRP. This is, posterior vascular area. The entire vascular area has been left. That is wrong. See this, big trial marks are there. And all the other areas have been left. What is the one? I always say homeopathic treatment. Homeopathy is a very good science. But ours is allopathy. And we advocate a different modality of treatment. So, if you want to do, you do complete laser. We often get, reference from the peripheral area. So, we have done the laser but still progressive. Remember, if you have done a good laser, chances of progression is there, I don't deny that. But that will be in a very limited number of patients. It is there, but it is very limited number of patients. So that's very important that you have updated the entire area. And also, the ablation, you don't think it is a PRP, one sitting, two sitting after 1 week, and third sitting after 3 weeks. No. If you can see the entire area, do it once, same day. Maybe, one or two cases you may not be able to do the entire vascular area, you can do it next day. Maybe sometimes the media is easy. You can inject the vaccine. Or maybe later, maybe second day, the media will be more clear and you can do it. So keep this in mind. Story number 4. So I think this picture you must have seen earlier. This child, 34 weeks, 28 week child, 1,000 grams. See this? What is happening here? What is the moral of the story? The moral of the story is that this child was not lasered in time. And you can ask me a question. I think maybe some of you will ask me a question during discussion time, but before you ask me my question, I'll answer it. How did you have all these features? The reason was, first time the child came, we advised laser. And second time when the child came, they just came for examination. We said that this is progressive. And if you won't get into the laser, you will end into the problem. The children, parents had some problem at home, some marriage function or something of that kind. We did not take seriously, and that's what is the result here. And now this is the time, you have to surgically intervene. If you don't intervene now, this is going to be in stage 5, and the child is going to get blind. So what is the what is early detection is the key, and act before it is too late. I'll just tell you one more story. The story is about 10 years back. The child is now over 10 years. The child was mostly an APROP. That time APROP classification was not there. And both the eyes were almost going to stage 4. The parents brought to me, I did the laser. I took the patient in the operation theatre. I did the laser almost 3,000 spots, maybe 2,500 spots both eyes. I knew that this baby, I knew at the beginning that maybe, I will not be able to save this child. And the parents came to me only once for the follow-up. In the follow-up, I saw the laser spots were there, but I wasn't clear. I did not know that the lasers have been effective. And after that, 3 months, the child didn't turn up, and I thought that the child has gone blind. This is the usual story. The other usual story is after 6 months, you will find the food in the hole. But then after 3 months, when the child came, the mother was standing in the OPD. She was standing there. I looked at her face. It looked familiar to me, and she was constantly looking at me. So then I told her what's the problem. She said, I want to show my child. And I thought that the child is, lying so a little bit hesitant, you feel, kind of this thing, you have not been able to serve the child well. But then immediately I asked the question, does the child recognize you? The mother said yes. And when the mother said yes, I was very happy. And then I examined the child and the exam was flat. The child is still coming to me. Very recently I again operated the child with the membrane on the posterior pole. I removed the membrane. The vision is 636 in one eye and 624 in the other eye. What is the moral of the story? The moral of the story is if you give vision to an adult, adult blindness is, much lesser than the childhood blindness. And the kind of satisfaction I had, I cannot describe in words. And thank you very much.